So we are having a struggle with staffing shortages, especially with respect to transportation. We have made significant changes in our routes and the number of runs that we make in order to get students here on time and home on a timely basis. So transportation is our largest area of concern. We do have shortages in paraprofessionals as well. There were 2 occasions this year that transportation did negatively impact our instruction because we didn't have enough substitute drivers when we had a couple of drivers out, and our transportation supervisor had to further restructure transportation, and that did unfortunately result in a couple of buses arriving late. With respect to paraprofessionals, we would like to have additional paraprofessionals to work in classrooms and in small groups with students to better support them in order to improve their student achievement. Unfortunately, with the detrimental effects of not having enough paraprofessionals, we aren't able to provide as much support as we would like to. I think the 2 biggest mandates that have had, given our budget, a challenge is, number one, the cyber and brick and mortar cyber costs. Those are unavoidable costs. With respect to special education, that additional mandate without the proper funding is very challenging for our school district. That is certainly a cascading issue with respect to cyber and charter because they do not have the level of students with disabilities that we have, yet they are getting more funding than we do for our special ed students who are enrolled with Pottsville Area School District. They don't have the placement costs that we do for students who are placed in alternative education. As well as the brick and mortar charter schools who may be getting, let's say, the $30,000 for a student who has a disability of speech, whereas that is certainly, a much lower cost and should be accommodated for. We are no different than any school district, in the world with respect to mental health. Obviously, COVID has cascaded some of those issues that we have found that initially starts with not communicating enough and therefore not asking for help when it's needed. Obviously, social media plays a role in negatively impacting the mental health of our students and staff. We have used our ESSER funds directly for mental health supports for both students and staff. Our students have greater access to guidance counselors. In each of our buildings, we have increased by at least 1 counselor in each building to provide more support. We also have additional resources and materials to work with students who are struggling with different aspects. We know that the results have been less students with discipline issues, and we also have decreased the number of Safe to Say Something calls because instead of going to Safe to Say for different issues, they are going directly to our counselors who are now not as overburdened as they were before because we were well above the threshold that is recommended for the counselor to student ratio, and we're better able to meet students' needs and now be proactive instead of waiting for a crisis to occur.